What's going on, everyone? I assume that if you clicked on this video, you're probably interested in going to med school. I would like to think that I've done a very good job in terms of my med school application. I've taken the MCAT and I scored 95th percentile and I got a 4.0 GPA in my undergraduate degree. But today I'm not going to talk about how to get the best MCAT score or how to maximize your study habits. No, today I think it's important to talk about the mindset of medicine and what kind of mindset you should have to go into med school. But more than that, I'm also going to talk about why AAMC has you jump through all of these hoops during the application process. Like I said earlier, though, these are merely numbers that can get your foot in the door in terms of getting into med school. You need them to get in, but they won't get you in. However, if you have completed or started the application process, I'm sure you're well aware of all of the other things that AAMC wants you to do: clinical experience, volunteering, shadowing, etc. And this brings us to the first important point, and that is I want you to reflect on why they want you to do these things. Why do they want to see that you've volunteered outside of medicine? Why do they want to see that you've had unique experiences and have all of these things going for you besides grades and a good GPA? And the answer is not they want to see that you can build a good resume, because it's more than that. In fact, if you go in with the mindset of, here are the things that the AAMC wants to see on my resume, therefore I'm going to just do those things because that's what they want to see, then you're missing the entire purpose. The point of the resume is that ideally it shows who you truly are. And med schools are hoping that you truly do want to volunteer. You truly do enjoy the clinical experience that you've had, and you enjoy shadowing. You enjoy learning about all of these things in medicine. And more than that, they want to see that you're a good people person, someone who's empathetic, who can care about other people and not see a patient as just a number or the next task during your day to complete. And I think it's important to assess and look inward and ask yourself why you're going to med school. Is it because you are the kind of person who enjoys to do the things that they're looking for, or is there some underlying reason? I've met so many people who want to go to med school for reasons that I would not consider worthy: money, vanity, prestige, etc. And I think one of the best ways that you can discern this is by looking at what AAMC wants to see on your resume and then asking yourself, are these the kinds of things that I would personally enjoy doing, even if they didn't want to see it from me? If the answer is yes, I think you're in good shape here, because it means you do actually enjoy the things that involve becoming a doctor and that you are a good person, I think, fundamentally. However, if you don't, if you're not super stoked on shadowing, if you don't like what you've seen in your clinical experience, then it might be a good idea to reassess what you're doing and what kind of path is going to be best for you. So let's say that you are this person who enjoys doing these things. This is a great first step, and I think it's a great indicator that you might be fit for being a doctor. However, this isn't the whole story, and this is where I will have to address the elephant on the table. And that is, getting into med school is incredibly, incredibly difficult. Now, I said earlier that I wasn't going to give any specific advice on how to boost your GPA or your MCAT score, and that's true, but I think it's important to look at these two things and to understand, why do they want to see them? Med school is incredibly rigorous, and they want to see that you can display that you can handle that level of rigor. And at the end of the day, completing many, many classes and getting near perfect scores in all of them and taking this grueling 8-hour-long test and studying for months, it displays that you can work incredibly hard at something and work hard to achieve your goals. Now, people can get really caught up in this, right? People complain that standardized tests and GPAs aren't necessarily a good proxy for whether or not you're going to be a good doctor. And on a lot of cases, and in a lot of ways, this is true. Just because you have a good GPA and you've done well on your MCAT doesn't necessarily mean that you're going to have great bedside manner or that you're going to be a personable person to work with and that you're going to mesh well with other people in the medical environment. However, what I think that these two numbers are is a ubiquitously excellent proxy for how hard that you are willing to work to achieve your goals. See, simply studying for the MCAT, spending those long days, nights, weeks, and months to study for this long 8-hour grueling test, see, it tells med schools something. It tells them that you're willing to put in the work and willing to work incredibly hard for something that might seem like you'll never use this information again. I don't know about you guys, but I don't know when I'm going to use the single letter abbreviations of amino acids anytime soon, but I learned them nonetheless. And all of this reveals a very important truth about medicine, and it may sound obvious, but it's that it's incredibly hard to become a physician. This difficulty does make sense, though, because at the end of the day, a doctor is the person that you put your life in their hands. And I don't know about you guys, but as a fellow human, I like to put my life in someone's hands who is a competent and excellent and skilled person who knows how to work hard. I guess what I'm trying to say is that yes, you will have to work hard. You will have to take these tests and work hard in your classes, but it's all for a purpose, because you really should want to work hard, because people are going to put their lives in your hands. So yes, you're going to have to work hard, oftentimes learning things that you will never use again in your entire life, but it's all for a reason. And that reason is that people are going to put their lives in your hands, and they want to make sure that you're up to the task. So we've talked about why AAMC makes you jump through all of these hoops in terms of your resume and the GPA and MCAT, and why hard work and excellence are so important to becoming a doctor. We've also talked about how well-roundedness, insofar as communication, working with others, clinical experience, is a very important trait that they also want to see in applicants. But this next thing that I'm going to talk about might be the most important thing of all if you're trying to decide on whether or not you want to be a doctor. And the reason for this is because all of the previous things I've talked about are very external things. They're things that affect other people around you, affect your patients eventually when you're going to become a doctor. But the internal part, I think, is going to be the most important here and is going to determine your success to the highest degree. And the internal thing I'm talking about is that I think the best doctors, the doctors who have the easiest time going through med school, the doctors who work well with their patients, who treat it like a breeze almost, are the doctors who make the entire process feel like play to them. This is personally how I felt about the experience thus far, which is why I feel like I can have an opinion on it. Oftentimes, I would hear classmates complaining about many of the things that we had to learn or do, or the MCAT, etc., etc. And don't get me wrong, I definitely had moments where I was incredibly discouraged and unmotivated and didn't want to do any of the things, any of the tasks in front of me. But by and large, a lot of these things felt like I was having fun, like I was playing a game of sorts. Even studying for the MCAT, I did the Blueprint online study course, and it felt like a game. It gamified it, which helped me a lot. And even learning these things like amino acids and physics and chemistry, it felt fun because it felt like a game. It felt like play. Now, at this point, some of you will probably say that this is a privilege that I have. Some people don't have this sort of privilege going on, and that there's plenty of doctors who don't get this level of play from learning all of these things and doing this, that, and the other. And as to the first point, you're right. It is a privilege to actually enjoy doing these things that other people don't enjoy, but that's okay. I think that in many ways we're all built a little bit differently, and we all have proclivities towards certain things, and finding what the thing is that feels like play to you is going to be really advantageous. And as for the people who don't necessarily find things like the MCAT or their GPA playful, I can guarantee you that these doctors have something about the career and something about their practice that does feel like play. Be it the patient interactions or how they work with other people or the technical procedures and surgeries that they have to do. I guarantee you some part of it feels like play. My whole point here is that when you're discerning what career path that you should go down, perhaps the most important question is, what is the thing that you can do as an adult that feels like play? Because that thing is simultaneously going to be the thing that is easiest for you to do, the thing that you get the most enjoyment out of, and the thing that you're going to be the best at. And who wouldn't want all three of those things all at once to be their career? And even more than that, if you think about it, if you do find that thing that checks off all of those boxes and it feels like play to you, that's going to be better for everyone else too, because you're going to be doing much better at that thing than perhaps other people will be, and everyone else is going to benefit from that. Now, before I finish this up, I do want to address one thing, and that is I'm not trying to discourage anyone from being a doctor. I think the idea that you can be anything or anyone you want to be is partially true, but there's some heavy nuance that has to go with it. And this goes back to that idea of play earlier. I think that we all have the capacity inside ourselves to work incredibly hard and achieve great things. However, I think that those things are going to be different for the vast majority of us. In other words, some people are going to be very, very well suited to be doctors. Some people are going to be lawyers. Some people are going to be teachers. Some people are going to start their own businesses, and so on and so forth. And I think the best way to discern what that thing is find the one that feels like play. And I guess my point with this video is that if none of the areas of medicine, none of the medical things that you have done thus far, none of the classes you have taken, none of the tests that you have taken, if none of these things have felt like play to you, it might not be a bad idea to do some soul searching and consider other career options. Because again, at the end of the day, I think most of us want to have that aspect of play where it's enjoyable to us, it's easy for us, and we're going to be way better at it than anyone else. I've seen a lot of people go down this path where they don't enjoy anything that they're doing in the medical world or in their university degree, but there's other things in their life that perk them up, that get them excited, that get them invigorated. And I think if that's you, you should listen to the things that get you excited. And perhaps medicine isn't the path for you, but that's okay. I think all of us are going to be great at different things. And if you get excited about something else, great, pursue that thing, and maybe you'll just change the world with that. However, if you're still here and you are still excited about medicine and you've put in the hard work and you've done all of the things and you've loved all of the things that you've done, keep going. You'll go far. Anyways, thank you all for watching. Let me know what you thought of this format of video. I'm kind of trying something new today, so let me know what you think. And if you did enjoy today's video, make sure to subscribe. Helps a lot. Appreciate it. Anyways, take care, guys. See you in the next video.